Hi, my name is Cara Davidson. Thank you so much for listening to my presentation about predicting maternal-infant attachment. In case you're not familiar, intimate partner violence, or IPV, can be understood as physical, emotional, and/or sexual violence within the context of coercive control by an intimate partner. Pregnancy is a known risk factor for IPV. IPV is also known to negatively impact maternal psychological well-being, infant birth weight, and maternal and infantile mortality. Another quick definition for you. Maternal-infant attachment is the degree to which a child feels secure and protected by their mother. Maternal-infant attachment is absolutely critical to infantile socio-emotional development, and impact, whether positive or negative, is sustained throughout the lifespan. Attachment can be broken down into many subcategories, but just to keep things simple, the broadest two categories are appropriate and inappropriate. As you can see, being interested, attentive, and caring are key to good attachment. Breastfeeding is also very important to the mother-infant bond. If you're questioning the source, all of these examples were taken directly from the dataset used later on in this presentation because nurses use their own discretion to determine appropriate versus inappropriate attachment. Considering that 1 in 3 Canadian women will experience intimate partner violence in their lifetime, in addition to the fact that over 400,000 babies are born annually in Canada, maternal-infant attachment is a significant public health concern. As such, it's important to determine the predictors of maternal-infant attachment. To explore this, I asked, what are the perinatal predictors of maternal-infant attachment in mothers who have experienced IPV? This was actually a secondary analysis using data previously collected by a team at Western University. The sample included pregnant women who had experienced IPV and displayed symptomatology consistent with PTSD, anxiety, and/or depression. And this was achieved using a retrospective medical records audit. The first thing I did when building this predictive model was to apply chi-square analysis just to kind of see the relationships that existed and identify potential predictors to use for a binary logistic regression to really hammer out that relationship. The only variable that emerged as approaching significance was type of IPV, and this didn't actually have any predictive value when placed into a binary logistic regression. Although only type of IPV emerged as approaching significance, we also expected to see mental illness come through, as in the literature, this is actually very well evidenced to negatively impact attachment. In terms of existing literature, the jury is still out in regards to the relationship between maternal-infant attachment and experiencing IPV. Some regression models have been developed, for example, by McMahon and colleagues, who successfully predicted attachment based on mental illness. However, a lot more research is needed to fully understand this relationship. Like any study, there are limitations that are necessary to understand to contextualize these results. So first, the small sample size really limits the reliability of the data, as only 68 participants were included. Caution should be exerted when drawing conclusions from such a limited sample because variability may be overemphasized, which increases the margin of error and thus reduces the power of the study. Next, all participants displayed symptomatology consistent with mental illness. This also limits the generalizability of the findings, as not every woman who experiences IPV also experiences mental illness. As such, these results cannot be generalized to populations without mental illness, as perinatal factors may have more or less influence on attachment in such a population. It was not possible to control for mental illness because it was an inclusion criterion of the original study, which this data was pulled from. Finally, this analysis did not examine how the timing of IPV may influence attachment. Some studies have suggested that childhood sexual trauma has an impact on the mental health sequelae of IPV, which could certainly impact attachment. Therefore, it would have been valuable to examine the timing of experiencing IPV to determine its impact on attachment. Unfortunately, this was not included in the scope of the original study and remains a suggestion for future research. For future research, it's recommended to determine the impact of individual risk factors. So, for example, studying the attachment of mothers who have experienced IPV but whom do not have mental illness. Also, mental illness is typically measured using scales, so a binary measure of mentally ill versus not mentally ill does not grasp the full picture. In future research, it would be useful to measure how the severity of mental illness in mothers who have experienced IPV may impact attachment. And finally, a larger sample size would be useful to generate higher power and improved results. Thank you so much for listening to my presentation. I really appreciate it. If you have any questions or comments or concerns, feel free to email cdavid53@uw.ca and I will get back to you as soon as I can.